Well, even if you would not contemplate cosmetic surgery, we know everyone is curious. Leanne Cusack with the patients before and after, the details on a facelift.
We tend to think of facelift as a 21st century obsession, but they have been performed for more than a century. The first in Berlin in 1901. A great deal has changed, to say the least. Dr. James Lacey of Kanata Plastic and Cosmetic Surgery is here with his patient, Sandy Skinner, to talk about the contemporary facelift. And many would say very courageous of you, Sandy, to decide to talk about it, but you say you've been very open about the process all the way through.
Oh yeah, it was never a secret.
And our viewers will want to know how old you are and how old you were when you had your facelift.
Okay, I'm 72. I first started thinking about having it done when I was 60, so that's how long it took to kind of get the nerve up. But yeah, so I only had it done in March of this year.
What are people's reactions? We're going to share the before and after in just a moment, but how have people reacted to this?
I've had every reaction from, have you changed your makeup? To I look great. A couple of people said, I don't really see any difference. So, but that's okay. That's better. That's better.
So, Dr. Lacey, Sandy said that she started thinking about this at around age 60. Is that a very common age for women?
It is. Usually, most of the aging in the neck and the jawline is during 50s. So people tend to come late 50s, 60s. But it's not unusual for people to come a little later in life, especially when they're healthy, like Sandy.
Well, I know our viewers have two questions. One, did it hurt? Second, how much did it cost? I guess there's going to be a third question, how long did it take to heal? But let's go through the procedure. We have a before and after you'd like to discuss, Dr. Lacey.
Well, I think the most striking difference here is the jawline and the neck. And as well, we did some dermabrasion around the mouth to smooth the lip and the chin.
And of course, the eyes.
Here we have brow lift and upper eyelids. With the lower eyelids, you see the smooth lid-cheek junction, we call it.
What's a brow lift? Explain the brow lift, if you would.
So the facelift incision in front of the ear extends up onto the brow so that the brow is lifted with the face all in one unit, which is what we did with Sandy.
And did you say an eyelid lift as well?
And a little eye tuck on the top of the eyelid and as well below. So this is an oblique photo. This shows the improvement once again in the jawline. You see how much more alert and bright the eyes look.
Sandy, what's it like for you to look at these images and to share it with everyone?
Oh, it's okay. I was never really shy about it, but I did notice when I first came in and saw those first two pictures, I saw my mother on the left. You know, it's...
Well, in looking at them, the word I would use to describe the change is subtle. So let's look at the next image because there's more to explain.
So this is a close-up showing the lids and the cheek again.
And of course, overall recovery time. We have an image that speaks to that coming up. What was it like pain-wise for you, Sandy? Because so many people would be curious.
Yeah, it wasn't a problem at all. I hardly had to take any of the painkillers. And I'd say after the first week, it was just maybe a bit uncomfortable. And by 2 weeks, not a problem.
Is that typical, Dr. Lacey?
Very typical. Yes, it's just skin work, really, a little bit of fat, some muscle work on the neck, so nothing very painful.
You mentioned the neck. We're looking at the neck now.
Yeah, so this is a very striking view. This is usually what brings people into the office, is the extra skin on the neck, and you can see how much improved that is.
And this is an overall, I guess, shot of the jawline, or you would have the technical term, Dr. Lacey?
Yeah, jawline's good.
Okay.
Perfect. Nice. It looks nice and smooth.
And you discussed, okay, I'm sorry, viewers aren't able to see, but Sandy just gasped and threw her hands to her face. You weren't so crazy about sharing this image with everyone. But the reason that Dr. Lacey asked your permission to share the image was?
This is at 1 week after surgery. So this is when Sandy came in for her stitches to be removed, and you can see the area around the mouth where the dermabrasion was done, and really not much bruising, you know, to speak of.
As opposed to the facelift I just described from 1901 and even those that we would have seen from the 50s or the 60s. And there you are, your before and after, and we're happy to have the after here in studio with us. Thanks for sharing your story.
You're
Sandy,
welcome.
we chatted about pain, we chatted about overall recovery time. You said that that after was a week from start to finish recovery time.
Well, after the first 2 weeks, I could go out. I mean, a month, almost totally recovered.
Great, and of course, a lot of people would like to ask you about the cost, Dr. Lacey.
Very good. So a facelift is about $16,000, plus eyes, maybe 2022, with brow, $25,000.
And you can learn more at Kanata Plastic and Cosmetic Surgery. Dr. Lacey's information is on our screen. Of course, it's located in Kanata on March Road. We want to thank you very much for joining us. And Sandy, thank you for being here.
You're welcome.
In all of your 72 years young. But youth is an attitude, isn't it?
Yeah.
Thanks so much.
Thank you,
Thank
Leanne.
you.